So today, Dr. Scholz, we're talking about quality of life, which I know is a topic we're both very passionate about. In fact, it's the entire reason the PCRI was created, was the focus was not being put on quality of life when it came to their treatment decisions. So when you founded PCRI and you understood that the world of surgery was basically running all of prostate cancer, how did you bring quality of life to the table, and why do you think it's so important?
Of course, it's a long history. There was a time when all the experts, including myself, believed that every cancer could spread and kill you. And there was a time, really, when alternatives to surgery were terrible. The radiation back in the late 90s was burning people and didn't get the job done and created a mess. There's been an evolution over the last 2 decades, realizing a couple of things. One, that that it is possible to treat prostate cancer now with other methods besides surgery and get the same or even better cure rates and have less harm as a result. The other issue that we've discovered over the last 20 years is there's many types of prostate cancer don't spread and can be safely watched or perhaps treated with minimalistic focal therapies. So those two things have allowed us to intervene now with a much more measured approach than what we used in the past, where it's cancer, your life is in danger, cut it out immediately. Whereas now it's an issue of, well, let's figure out what type of cancer it is, and let's look at the many options that we have to try and finesse the situation so that you're able to sidestep some of the common and serious side effects of surgery, such as incontinence and sexual impotence.
One of the issues that we encounter when we're on Helpline and we're talking to a patient who's newly diagnosed is the concept of time. A lot of patients think that they don't have enough time to make the right decision and focus on their quality of life because it's cancer. And isn't cancer fast growing and we need to get it out? And they said it's maybe a Gleason 8, 9, 10. I'm scared. What would you say to that?
I'd say that's the main struggle that I have is trying to help people recalibrate in terms of how imminent this whole prostate cancer situation is. If you think of all the other cancers, the lungs and the bone cancers and the brain cancers, they are emergencies almost, and you want to act quickly and eradicate them, and hopefully before they spread. Prostate cancer spreads very slowly when it does spread, and in many cases doesn't spread at all. People have asked, should we really be calling this cancer? Maybe this is sort of a prostate growth, not really a cancer. My old writing partner, Ralph Blum, came up and said we should call it the uncancer, as they had an advertising program for Coca-Cola, and 7-Up was calling themselves the Uncola. And so maybe we'll call prostate cancer the uncancer. Anything you can do to shift this away from the idea of cancer and how imminent the need is for treatment, and allow people to think about it more. And I think there's another issue that comes up in this whole process of quality of life versus risk of death, and trying to weigh those two things. And that has to do with the process of thinking through the complexities of prostate cancer. There's a lot of moving parts to this whole process, and not everyone wants to do that. Some people just want to delegate it to someone in a white coat. Tell me what to do, doc, and I'll just follow through. You're the expert. Don't confuse me with the details. It's an arduous process. I mean, we go on in these videos, and we haven't exhausted the topic of prostate cancer. It's a huge topic. And there is so much information, and it's not like yes or no. This is relational information where, this means this in this context, but in this context it changes. So you have to use the knowledge in context of the type of cancer, the age of the patient, the specific quality of life goals that every individual has. I think what you want to emphasize is that the idea of all prostate cancer is dangerous and life-threatening and therefore requires a pedal-to-the-metal approach is incorrect thinking for prostate cancer. Correct thinking for other cancers. Incorrect thinking for prostate cancer.
I think one of the biggest topics we talk about in PCRI is active surveillance. So can you explain how many prostate cancer patients statistically are like a Gleason 6 where they don't have to go to immediate treatment?
So about 50% of men diagnosed every year in the United States, which approaches 200,000 cases a year. Of those, about 100,000 are Gleason 6 and have zero metastatic potential. You say, well, how ethically can any doctor suggest treatment? Well, just hearing the word cancer is say, well, you don't have it now, but you might get it later. Or your biopsy might have missed something high grade. So this whole issue of cancer and fear is in the air. So people are motivated to jump in and do a preventative treatment against the possibility of the cancer becoming a problem someday. And the industry is not designed to talk you out of treatment. The industry exists to treat people. And there are people that do need treatment. That's completely justified. So it's a problematic situation if the patients don't take the bull by the horns and say, I'm going to commit to understanding what's really going on here. They're going to get swept along in the emotion and the way the industry is just sort of predisposed to treat people. Sometimes it'll be the right treatment, sometimes it won't.
So like you said, when it comes to the medical industry not being designed to focus on quality of life, you're in there, they're focusing on treatment. Why is that the case? Why are doctors not focusing on quality of life? Can you go into more in depth of why that is?
In some ways, they're diametrically opposed. So the best quality of life in terms of function, urinary and sexual function, is to have no treatment at all. So there's always going to be a trade-off, and this trying to balance the trade-off of the risk of the cancer being a problem someday in the by and by and the immediate side effects of treatment is an equation that requires some depth of understanding of what's really going on. And that takes time. And it's not a very pleasant journey, talking to different experts, some who have one agenda, another has a different agenda. It can be painful. There's a lot of resources. The PCRI, of course, offers those resources. There's support groups out there. Talking to, doctors who don't have a direct connection to doing one particular type of treatment, that can be helpful. But what makes it more difficult is the industry is changing so quickly. There's tremendous amounts of new technology, and it's hard for the doctors to keep up with the latest methodologies.
So if you have a patient who maybe they've had a urologist for quite some time and they're newly diagnosed, they really like this doctor, but he's not focusing on their quality of life, how do they approach that topic with them? Do they just get another doctor, or do you think that they should bring up their quality of life and try to talk about other outcomes?
Well, a lot of times this is in the context of making a decision about treatment. So the big moments of decision are, am I going to get treatment? Am I going to pursue active surveillance, or am I going to undergo some form of therapy? That's probably the biggest first question. In my opinion, all 3+3s can be watched, and there's certain favorable types of 3+4s that can be watched. And then as men get older, into their 80s, you can watch 4+3s and 4+4s. The number one issue is, should I treat it at all? And then if the risk appears excessive for watching it and the decision is arrived at that yes, we should treat it, then that's a new arena of, okay, now what kind of treatment do I need? What will offer optimal cure rates with minimal side effects? And a lot of people just jump to point two. They just figure that it's cancer, it needs to be treated. So there's a first step. Does it really need to be treated? Because at least half of the men diagnosed every year can be watched. But then if we do have a type of cancer that should be treated because of the risk of spread, then it's an involved process many people are familiar with, of talking to surgeons and radiation therapists and focal therapists and trying to shop around and find out which one will be the most, which one will fit your quality of life goals and offer the best cure rates.
No, that makes a lot of sense, because I think that over and over again, the number one thing I see is that patients have to champion their own quality of life at every juncture, whether that's at the beginning of treatment, whether that's in the middle of treatment, afterwards, because there's such a short amount of time that they're meeting with their physicians. The physician doesn't have time for the quality of life conversation, maybe the nurse. Honestly, it's really up to the patient to focus on that and to fight for that. So it sounds like what you're saying, it sounds like between choosing the doctor, taking time to make the right decision, doing the right research, whether that's PCRI videos, other advocacy groups, support groups, websites, and doing their own research, that is one of the only ways that they can really promote quality of life in their lives. Thank you so much for watching this video on quality of life. We're honored to be here for you, but I want to bring up a couple things that I hope you remember. Number one, you have time. I know that cancer is a very scary situation, but you do have time to make the right decisions. Also, remember, get a second opinion. I know it may seem a little bit cumbersome, but lots of opinions can help lead the direction of where you want to go with your life and your treatment decision. And the third thing is to remember, it really is all up to you. Your doctors may be strongly suggesting something, but you're the one who's going to be able to make the best decision with all the research you do and weighing all of your options. And your options are the most important thing to us. So we're honored to be here for you. Don't forget to subscribe to our YouTube channel. We come out with new videos every week, and visit our website, PCRI.org. We're honored to be here for you.